13 years ago, when Joe learned he had prostate cancer, he wondered if he would be cured or if he'd have to endure significant side effects of treatment in order to be cured.
When I was diagnosed, I was recommended to take the high-dose radiation, which was unique at that time, but I had the trust in the doctor, and it worked out very well.
Joe was treated here by the Radiation Oncology Department at OSF St. Francis Medical Center in Peoria, Illinois. OSF St. Francis Radiation Oncology promotes better education on cancer control and treats patients with 3 types of modern radiation therapy: high-dose rate radiation implants, a new form of brachytherapy, the Varian Trilogy linear accelerator with its rapid arc radiosurgery system, and the Perfection Gamma Knife unit. These emerging radiation treatment techniques allow for non-destructive cures with minimal side effects.
Radiation treatment is one of the most effective modalities for cancer cures, and our mission is to use that modality as effectively and efficiently as possible. We try to give a very high dose when we can, but to a very discreetly defined target in order to avoid side effects, because these patients have enough to deal without having a lot of radiation side effects. Brachytherapy is from the Greek meaning treatment over a very short distance, so it means that radiation sources are actually implanted into the tumor. Other types of radiation come from beams outside the body, and if those beams are given over many treatments, that's radiation therapy in the traditional sense. Radiosurgery is really almost a one-time high-dose treatment. You might think of an operation being done, but with no incision, just a very sharply defined dose of radiation, very high intensity, but very well targeted in order to destroy the tumor. The biology of cancer treatment has shown that the harder and faster radiation is given to tumors, the better they respond. And so gamma knife, high-dose rate brachytherapy, using the Trilogy with rapid arc in a very focused and intense manner, all share the same biology. They all share the concept that you're giving a very high dose that tumor can't stand, that it can't repair that damage from the radiation, it can't possibly survive. These high doses of radiation given quickly are really proving to have an optimal effect on cancers.
This is the Trilogy stereotactic system, a linear accelerator that delivers all advanced forms of external beam radiation therapy. This cutting-edge technology gives clinicians the ability to maximize the dose of radiation given to the tumor without damaging any of the surrounding healthy tissue.
The patient is treated with thousands of beamlets of radiation as the machine rotates around the patient. Each of those beamlets can have a different intensity, and in the aggregate, they shape the radiation exactly to the patient's needs.
OSF St. Francis Medical Center has some of the most advanced radiotherapy equipment in the country. This is a treatment plan of a patient who is going to receive radiosurgery of the spine. We can see here that the spinal cord is mapped out. Using CT myelogram technology, we can also see the fluid around the spine, and so we know exactly where the true spine is, and we can keep the radiation dose off of that area while putting the high dose into the affected region.
I do work in healthcare, and I do see a lot of cancer patients. I chose the high-dose rate therapy, and then to be followed by 5 weeks of external beam therapy for my prostate cancer. I was treated with my 5 weeks of treatment on the Trilogy rapid arc system. It's a very quick treatment. It takes me about 7 minutes to lay there. The treatment itself, painless. You just lay there and you are treated, and it takes care of it. I'm doing very well. I have just completed my 5 weeks about a week ago, and minimal complications, basically a little tiredness to go along with it, but that's to be expected with what I've gone through.
The sophisticated radiotherapy equipment that we have can be dangerous in the wrong hands. That's why we've developed comprehensive quality assurance programs to analyze the performance of this equipment. We have 2 tiers of quality assurance programs. One is machine-specific, where we analyze the performance of those machines on a routine basis, ranging from daily all the way up to semi-annual. We also have patient-specific quality assurance, where we analyze the performance of the machine against the predicted model in the computer and how that machine will behave against that model.
This revolutionary perfection unit has elevated the level of treatment for intracranial abnormalities, including certain brain tumors and metastasis to the brain, to a new standard. By eliminating several of the previous limitations associated with the Gamma knife, the perfection allows for extended access to many targets in the brain.
A number, nearly 200 small beams of radiation, each of which are relatively low dose, are focused on a small area. In that focused area of radiation where all the beams come together creates a very high dose of radiation, so we can deliver that high dose to a tumor or whatever that target might be while preserving the surrounding brain. The Gamma knife allows access to multiple targets and very difficult targets within the brain because of its ability to allow us to formulate the treatment plan to preserve the brain structures that are very nearby while treating the tumor to a high dose. As a surgeon whose specialty is complex brain tumors of the skull as well as radiosurgery, I am exposed and understand both elements, and it has allowed me to use radiosurgery with the Gamma knife perfection when I believe that a tumor is too dangerous or presents a high risk to the patient for an open surgical operation. The Gamma knife perfection is really an invaluable tool for neurosurgeons. Knowing that it is available, understanding its use, allows us to make a greatly informed decision regarding what's best for patients. We can offer them both open surgery or Gamma knife, give them the risk benefits of each, and then direct them towards what we feel is best, and thereby controlling their tumors best while causing the least amount of problems from the treatment itself.
While many may wait for a cancer cure, others are deciding to be responsible and learn about their individual cancer risk and how to reduce that risk. As a result, a new spirit of hope is emerging for all who take personal responsibility for their health.
We're trying to encourage patients to understand that cancer control means that by not smoking, by exercising, having some control over what they eat, that they're able to really substantially reduce their risk of getting cancer in the first place. And secondly, those cancers that can't be prevented can often be screened, and we can pick them up early, and then we can use these treatment tools in order to give the patient a full life and a life that is not hampered by radiation complications. Joe's prostate cancer was treated with high-dose rate technique at a time when that was a very novel thing to be doing. If he would have been treated with external beam radiation to the fairly modest doses that were possible all those years ago, his chances of a local recurrence would have been 50%. We know that with the technique that he had, the control rates now being seen at 5 years are 94 to 98%, depending upon how aggressive the underlying cancer is.
I've had no side effects. My cancer is cured. My PSA is below 0.1 today.
What's been great about the high-dose rate radiation implants has been that we've seen very few side effects from that when measured at 8 years. Very few sexual, bladder, or rectal side effects. And we've also seen that 97% of patients with early prostate cancer remain free of any clinical evidence of recurrence. Currently, the onboard imaging system on the Trilogy unit is a CT-based system, X-ray based, and we think that by further using MRI techniques, we can define where tumors are at, and with techniques like brachytherapy can ever more target those lesions and give even more intense doses to the sites where the resistance to the treatment would be the highest. We have a lot to offer these days in cancer therapy that's not destructive, and cancer therapy that's very effective. But people have to help us. People have to be involved in their maintenance of their own health and in picking these tumors up early enough.
By applying what is currently known about cancer to our daily eating, exercise, and behavioral practices, many cancers can be prevented. Those that cannot be prevented can often be detected early. Early-stage cancers can almost always be treated curatively with preservation of normal tissue function. Learn how to reduce your personal risk of cancer and how new radiation treatment methods are bringing a new spirit of hope to us all. For more information, go to osfstfrancis.org/donate or call the number on your screen.